it's good to know that all healthcare providers and professionals are all working together to actually do this for services and actually promote this, because it's good that they can have something like a small size that they can actually put in the wallet that will actually prompt them to actually know that they're entitled to this kind of service or services, and actually hand this to the GP or service provider, what services they're using. Well, look, I'm actually entitled to this, and I think I should have a physical health check because the medication that I'm on can lead to all things like diabetes, high blood pressure, which people are not aware of the side effects when they're on the medication or what services to ask for. So I think it plays an important part to let people know what services are out there and what help and support that they can actually get. Yeah. And I would like to help promote this as well by giving this out to services on a day-to-day basis once it's all been complete.
I've been on mental health service now for about 22 years, and I know places to go. I mean, there's been many times I've had a bad episode and I've had to make myself to organisations for help. So yeah, it's good to have information on you.
I mean, it is very important. A lot of people, I read somewhere, about 50% of people who have mental health problems go on to develop physical problems, but their physical problems are neglected because only mental health problems are being concentrated on. And myself, I've developed a few physical problems, and I had to actually ask my GP to carry out these tests, and then I found out that I've got high blood pressure, I've got high cholesterol, I'm diabetic, and I've got fatty liver disease. So I had to ask for these tests, and I also run a group called the Positive Mental Health Group, and I wanted to raise this in the group and say to people, look, it's important that you look after your physical health, but I didn't know how to raise it because I didn't want to scare people.
I bump into service users in places and pubs and public places and that, and just maybe giving them a contact number when they're in distress or something. That makes all the difference.
Service users actually feel that they don't know what services to ask for, and because they're not in the right frame of mind at that particular moment, which is no fault of their own, they do not know what services are out there and what services they can access, or too frightened to ask for these services from their GP or service provider.
The kind of language you use is the kind of language service users will hopefully understand, plain English. I mean, sometimes, language can be really ambiguous and people can't understand it. And one of the reasons I think it's great that the service users were involved in this, because at the end of the day they will be using that card and the services on that card, so they know they've put it together. And if they need to explain it to other people, they're well placed to explain it to other people and all.
You do feel like a victim sometimes. You do feel very savage about things, and but sometimes you're just someone who needs NHS support.